Hi everyone, my name is PT Slosser, and here's my project on fibromyalgia. So fibromyalgia, it's a neurologic health problem. It causes widespread pain and sensitivity to palpation in people. It's made up of multiple symptoms that can be managed, however. So it's an infectious illness, physical trauma, emotional trauma, or hormonal changes can cause development of fibromyalgia symptoms. So common symptoms of fibromyalgia are pain or soreness throughout the body, headaches, numbness or tingling in toes and fingers, almost like pins and needles, and fatigue. As you can see in this diagram here, here's some more like the tender points of fibromyalgia, so in the back, up near the head, and then just the cardinal symptoms: pain, stiffness, fatigue, um, and this can cause, or pain over time will cause issues with sleep. It'll be non-restorative sleep is what it's also called. So epidemiology of fibromyalgia. So 10 million people in the U.S. are affected by it. That 3 to 6% of the world's population are affected by fibromyalgia. Um, so you're more likely, 35% more likely to be diagnosed with fibromyalgia if you have rheumatoid arthritis previously or currently have it. Um, so it's very common in women, fibromyalgia. 9 out of 10 people are women who are diagnosed with it. So men, it's very unlikely that you can get it, but it's still possible. So between 20 and 60 years old is when the age of onset typically is. The average age is 35 years. Um, and then it's found in all ethnic and socioeconomic groups at similar rates throughout the world, so there's no difference between um, those groups. So fibromyalgia and exercise. So physical activity is a non-medicinal way to reduce fibromyalgia symptoms. It's important to start slow with an exercise program, with exercise bouts, only a few minutes at low intensity. So rushing a client into an exercise program, it can cause extreme pain, and the client will then not want to do it, so it decreases adherence to an exercise program by rushing the client into it. Low intensity exercise should only cause a mild level of pain at first, but pain from exercise will subside over time. If a lot of pain is experienced at any time, however, exercise should stop until pain levels below 5 on a numerical scale of 1 to 10. So as you can see here in this diagram, there's the numerical rating scale. So 10 is the worst possible rating. 0 is no pain at all. So this is a very easy way for a client to tell the trainer, hey, here's my pain level right now. I need to stop or I can keep going. So fibromyalgia and exercise, again, moderate intensity exercise is ideal to receive health benefits. This will be the same for a healthy person as well. High intensity exercise may be tolerated for some, but it's you only need to do moderate intensity to have the health benefits. It's all about the pain level. So if high intensity exercise works for the patient, then definitely go ahead and do it. And then low impact activities like swimming, walking, yoga, they all decrease the chance of a flare up or increasing symptoms of fibromyalgia. As you can see, those 3 examples, they're not high intensity; they're more moderate, low intensity exercises, so they would be better and more likely to be done by someone with fibromyalgia. So antidepressants, they're used a lot for decreasing pain levels in patients. So what they do is they increase the levels of serotonin in the body. So that can be done through Celexa or Zoloft. Um, People are given greater tolerance for exercise and increased motivation to exercise. Um, and then NSAIDs are non-steroidal anti-inflammatory drugs. They help with pain tolerance. However, the big risk of it is it increases your risk of heart attack or stroke. So it's just something to definitely think about before you start taking them. So over the last few years, we've seen in the United States as well. Medicinal marijuana, it's been effective for some patients in decreasing pain levels. And I mean, medicinal marijuana is also used for many other chronic illnesses or very serious illnesses, cancer, for example. So research wise, fibromyalgia, there's no research that definitely says, hey, fibromyalgia is genetic. Um, some say it is genetic, some say, or some studies have said it is genetic, some have said it's not genetic. So that's something. There's no definitive way to diagnose fibromyalgia. Most doctors diagnose the disease, though, through blood testing, physical exams. So you'll get inflammation markers and blood tests that will show, hey, this person has this inflammation, they might have fibromyalgia, and you combine that with a physical exam done by the doctor. Fibromyalgia symptoms, like joint pain, tenderness with palpation, they're very similar to symptoms of multiple sclerosis and rheumatoid arthritis. So there's sometimes a confusion or very similar symptoms of a physical exam, blood testing between these two. There's a consensus, however, between doctors. So the regular exercise, aerobic exercise especially, improves pain, function, and overall quality of life in patients. So for my case study, it was a 30-year-old woman diagnosed with fibromyalgia at age 25. She has no other health issues. Pain is commonly experienced in elbows and knees. So she's an accountant, so she sits most of her day, or almost all of her day. Her parents are still living. She does not smoke. Her resting heart rate's good at 60 beats per minute. Her resting blood pressure, is a little elevated, but not of concern. 122/80. Her BMI is 32, so that makes her obese. So that's something you want to be careful of. Her cholesterol is high, so it's 220, and her fasting plasma glucose is good, so she's not diabetic. And importantly, she's cleared of exercise by her doctor. So age is not a health concern. Um, Parents and relatives are healthy. She doesn't smoke, which is great. However, she is sedentary. She's obese. She has high cholesterol, which is all something we want to change. So the goals of exercise for her would be decrease her BMI to less than 25, reduce blood pressure to 120/80 or below, develop exercise habits that will reduce daily pain levels. So referencing back to that scale I showed you before, below 5 on a numerical scale of 1 to 10, and increase overall body strength, aerobic capacity, and flexibility. Testing should stop if pain level of 6 or higher on a scale of 1 to 10 is experienced. Body composition can be in the same way as a healthy individual will be tested. So you just have to be careful, though, of aerobic endurance, flexibility, muscular strength, and muscular endurance testing. They may have to be adjusted to not create more pain for the client. And non-weight bearing short duration tests are best as well for avoiding an increase in joint pain. For example, aerobic endurance, you have a 6-minute walk test. So it is weight bearing, but it's short duration, and there's not a pounding on the joints from walking. Flexibility wise, a sit and reach, so it's not weight bearing, easy to do. And then muscular strength wise, 1 rep leg press, non weight bearing. There's good data to compare, or good normative values. And the muscular endurance 1-minute curl up test, that's also non weight bearing, and there are values to compare it to, and they're commonly accessible. So exercise prescription wise, you want to stop if pain level 6 or higher on a scale of 1 to 10 is experienced. And as referenced before, low impact activities are best for preventing pain. Frequency wise, you want to do 2 to 3 times a week of resistance training. It's important to make sure that you have at least 48 hours between sessions. Intensity, 50 or 60% of one rep max to start. You can gradually increase this to 65 to 80% of the 1 rep max. And then 2 to 4 sets with 4 to 5 reps per set. And then you can gradually increase to 8 to 12 reps per set. Low impact, non weight bearing activities are great. Leg press, for example, is great. For aerobic exercise, you can definitely start with 1 to 2 sessions a week, gradually progress to 2 to 3 sessions a week. So you want to start intensity-wise at very low intensity, so 30% heart rate reserve, and then you can gradually change that to 40 to 60% of the heart rate reserve. Time-wise, start with 10 minutes exercise, so very minimal, and gradually progress to 30-60 minutes of exercise. Type-wise, you could do stationary bike, so that's not weight bearing, or you can do walking, so it's of low intensity. It's easier on the joints than running, for example. Flexibility-wise, you start with 1 to 3 sessions a week, and then over time you can gradually progress to 4 to 5 times a week. You want to stretch the muscles to the point of tightness or minimal discomfort, so you don't want to elicit a lot of pain. This would be the same for a healthy person. And then you can hold each stretch for 30 seconds. Static, non-weight bearing stretches are great, so a seated hamstring stretch would be a great example. So just some of the recommendations I found during this. The woman's exercise testing, exercise prescription can be very similar to a healthy person's. She's just limited by the symptoms she experiences from fibromyalgia. So if she has more pain with certain things, she should stop, or you can try a different way to test what you're trying to test. It's important to educate the subject on the differences between post-exercise soreness and pain experience from fibromyalgia. These two things are commonly confused, and so a person that's not used to exercising may think they're having pain from fibromyalgia, but it's actually soreness from exercising for the first time. And then here's my works cited. As you can see, I used several different websites. And thank you for listening to my presentation.